Cosmetic surgery has become a billion-dollar industry in Australia. But as more and more clinics pop up across the country, doctors are raising concerns about botched procedures as well as the kind of anaesthetic some of the facilities are using. The peak body representing cosmetic surgeons says some doctors within the industry may be putting patients at risk. Now the ABC can reveal health authorities are investigating one of the country's most popular and successful cosmetic clinics. The ABC's medical reporter Sophie Scott has this exclusive report.
Teens and young adults are turning to cosmetic surgery to enhance their assets.
At the moment I'm about an A, I think, and I would like to be a full C to a D.
In the quest for the body beautiful, going under the knife for cosmetic surgery is almost becoming routine.
Like, my lips has really changed me as a person.
But when things go wrong, the results can be devastating.
There have been some deaths. People can have infection, blood loss, quite serious infection. They can have wounds that take a long time to heal.
One more mouthful. Quick.
After I had my daughter, I breastfed and wasn't happy with my boobs at all.
Mummy do.
After researching different doctors, Kayla Cole paid a Gold Coast cosmetic surgeon $17,000 to get breast implants.
I'd spent a lot of money and thought that I was going to a really good surgeon, and that wasn't the case. The result was devastating, really. At the end of the day, I'm more self-conscious now than I was after having breastfeeding boobs. Both sides have now fallen through the pocket, and the muscle hasn't been released properly on either side either. I can actually see the rippling on both sides of my right especially, but now my left's starting to do it as well.
Kayla's just one of thousands of Australians who undergo cosmetic procedures each year.
The problem at the moment is that any doctor can call themselves a cosmetic surgeon, whether they're good, whether they're bad, whether they've got training or whether they haven't.
The operations are performed not in a hospital, but often in suburban clinics with patients under conscious or twilight sedation. That's where patients are given a combination of medications, including strong painkillers and local anaesthetics, to reduce their level of awareness, so they're groggy but awake. It's a practice many surgeons say is extremely risky.
Unfortunately, conscious sedation can become unconscious sedation very quickly, and the control of the airway can be lost, and patients' lives have been put at great danger by having extensive procedures done in these facilities.
And this is the consult room here. We'll run through what to expect on the day of surgery.
The Cosmetic Institute is one of the nation's most popular cosmetic surgery clinics. It's now under investigation by the New South Wales Healthcare Complaints Commission for their alleged inappropriate use of anaesthetics. The Cosmetic Institute, or TCI as it's known, does more than 5,000 cosmetic procedures a year, with breast implants for as little as $8,000. It can use twilight or conscious sedation, but it's not licensed in New South Wales to use general anaesthetics or deep sedation on patients. In a document obtained by the ABC, senior members of the Australasian College of Cosmetic Surgery have written to health authorities saying it's received reports that TCI is providing surgery under deep sedation while not being properly licensed to do so. It warns that the Cosmetic Institute may be placing patients at risk because of an apparent failure to comply with regulatory standards and accepted professional practice.
We've asked them to investigate, and the authorities have agreed that a full investigation is necessary. And we urge the authorities to complete that as quickly as possible, and if there are problems, make sure that the laws are being complied with and that patients are not put at risk before some terrible tragedy does occur.
The Institute maintains the complaint was made by a competitor and not a patient. But it's not the first time the Cosmetic Institute has been in the spotlight. Earlier this year, 21-year-old mine worker Amy Rickers suffered a cardiac arrest during a breast implant procedure.
The second pocket was made and then my heart started going out of rhythm. And then that's when they had to stop the procedure itself.
She believes the heart attack was probably caused by the local anaesthetic. Amy's case moved New South Wales Shadow Health Minister Walt Secord to draft legislation to tighten rules about who can perform cosmetic surgery.
Did this look like one of the surgeries that you saw?
Absolutely. Yeah, that's exactly what it looks like. And
the Cosmetic Institute invited him to see the facilities himself. What he saw shocked him. Walt Secord alleges he saw 2 women who looked unconscious.
What were you told by staff about the use of sedation at the Cosmetic Institute?
I was with my staff member and we asked the person giving the tour, are they under, quote, a general? And the person giving the tour said, yes, they are. Procedures, the team, about.
The Cosmetic Institute denies the exchange took place and says no one told Walt Secord patients were under a general anaesthetic. The Cosmetic Institute says it's not able to respond to specific allegations, but say any suggestion they've administered a general anaesthetic without a licence is false.
I don't think it's at all safe if it's not done in a licensed accredited premise.
Some of Australia's top plastic surgeons maintain even twilight or conscious sedation outside a hospital or day surgery is dangerous.
All of the state departments of health, in combination with the Commonwealth, should take the lead in this before patients die.
What about some clinics offering cheaper procedures in an office-based setting?
Well, it's very simple. What's the cost of your life? You can't put a figure on that.
Complaints across the cosmetic surgery sector have prompted a nationwide crackdown.
It's a continual source of complaint, and there are some practitioners who attract more complaints than others. Some of that's to do with their skill, some of it's to do with their manner, probably a lot's to do with how well they prepare the patient and how realistic the expectations are that they paint.
The Medical Board is looking at measures such as a mandatory 7-day cooling-off period between booking surgery and going under the knife. The College of Cosmetic Surgery also wants stricter controls over which anaesthetics are administered.
If deep sedation and general anaesthesia is being given in a clinic that's not licensed to do so, patients are going to be at risk. We have already heard that there have been complications such as cardiac arrest and fitting. The concern is that if nothing is done, a patient may die.
Kayla Cole wasn't treated by the Cosmetic Institute. She survived her surgery, but she now lives with feeling disfigured and disillusioned.
What's your message to other women considering cosmetic surgery?
I wanted other women to be aware of these people that are making millions and millions of dollars and doing botched jobs. Like, he's butchered me, really. At the end of the day, that's what it comes down to, and yeah, for somebody else to go through what I've gone through, it's not nice.